everyone. We're back with another heart to heart, and this time we're using the same format as the last video, and we're gonna get to know Dr. Alia a little bit better. And hi, first of all.
Hi.
Hi,
And I
but
can't wait to, and I don't know what's coming, so I'm bracing myself. I'm a little bit scared.
so I think the fact that you're a doctor and a patient, there's a lot of things, there's a lot of things I want to know. And I think a lot of people as well are curious about. And we could talk for hours about this, but I'm gonna try to be concise and try to ask the right questions. So um, SPS does have a role on your mental health. And how would you address, how would you explain, or how would you help someone that has SPS and comes to you and say, I need help with my mental health?
That it's a great question. It's one, like you said, we could talk about for hours and hours and hours. Um, but if somebody came to me, referred, say, from a neurologist, and they wanted psych support for a chronic pain disease like ours, and they said, I have SPS, first I'd want to know which symptoms are really bugging them. Is it the anxiety? Anxiety comes with this disease because our autoantibodies are attacking the very brakes on our nerves. And while that is mostly felt in our skeletal muscles, it doesn't spare the brain, and the brain is the mind. So as the brain neurons are functioning super fast with no brakes, not enough brakes, we feel the effects in our mind. Um, nerve impulses in the brain can make you feel manicky. It can feel good. It can feel anxious. It can feel terrible. And a lot of things, when you start to get treated, usually with meds, with other treatments, that kind of starts to come down, and you realize how much actually mental health you've been dealing with in with your bodily symptoms, because it's easy to focus on the body, and to really just concentrate on it, because we want to separate ourselves from our mind and mental health a lot. It helps to say, this is my leg, this is my my traps in my neck hurt, not I'm freaking out, because that's much scarier of an admission, even though a lot of times we probably are freaking out. So I'd want to dig, what are the symptoms? And usually, I would say with SPS, although I've not treated SPS
Mhm.
patients, that were, one in a million. But I would want to know anxiety, depression from having a disease. That's very common when you have a general medical condition to get depressed. It's also very hard to keep this disease from interrupting your sleep, because fast makes you not sleep well. So insomnia. So I would say anxiety, which is an umbrella of neurotic disorders that encompasses our agoraphobia, that I know that I kind of deal with a lot. And so I would say, how do we deal with it? I would say, somebody's got to get to, or you do, which mental health symptom is bugging me. Am I anxious? Am I depressed? Like, do I not take pleasure in the things that I used to? Anxious being like nervous, worried, ruminating, and then, or depressed. Or can I not sleep? Not sleeping, insomnia alone will cause depression, um, make you feel inattentive, all kinds of things. So I would say first, we've got to get to the symptom that is bothering you the most. Everyone's different. Every patient's different, and every doctor's different. And I would say that one key thing is that you and your neurologist will be in this together in terms of what kind of mental health professional should I see? What would be, depending on what you're struggling with, your neurologist will have a really good idea of what type of person to send you to: a psychiatrist, a psychologist, a licensed social worker with, manual based therapies of cognitive behavioral therapy, which is CBT. And that's how I get through the agoraphobia. So there's lots of stuff out there for us. First, we have to just figure out what's bothering us the most in terms of our mental health and what SPS is wreaking havoc on it. I'll stop there because I know it's a lot, but it is a lot.
So you said something that's great, but that also makes it more difficult because we're going so through so much. We have to figure out which symptom is bothering us the most. So we have to consciously address that there is a mental health component to our disease. So there's also the fact that so many people are not aware and don't understand our disease. So sometimes, I mean, I've had this misunderstanding from people, and at the beginning, I lacked a bit of confidence, and it was like, am I crazy? Is like, and because of the reaction of people, and because of people like not understanding, it's a legitimate question. But then I got a bit better and I got more symptoms. It was very difficult to handle. And I'm sure other people with SPS have had that thought. What do you think about what I'm saying?
I think that there's probably not one of us that has escaped. Am I crazy? Because this disease is, well, in psychiatry, there's a canon of diseases to which we draw from our DSM, which has been more recently revised. So we're in the DSM-5 and now a new revision. So we're constantly thinking how better to explain our disorders like neurology. And so the psychosomatic disorders, bent not broken, the mind and the body, the psychosomatic disorders, we have names for each of them. So you're not am I crazy? The first thought, if you're ever thinking that, is that, well, crazy is the actual scientific field. Let's call crazy psychiatry or psychology, anything that deals with the mind. And let's say that instead of am I crazy, it's am I suffering with some mental health situation that I wasn't before? Because crazy is a word I don't think we're going to get rid of anytime soon. I kind of hope we don't. I use it a lot, even though I really shouldn't, but I use it in a fun way. But I never use it to refer to a person who is actually struggling with a mental symptom at that moment, or at any time, because that's not crazy. That's depression, that's anxiety, that's mania. That's We have a name for all of them. And like I said, we also have a name for the spooky, scary ones that are psychosomatic, that have a body component and a mind component. The subconscious is so strong that you can be okay in your mind and actually be stressed in your core. I think that's sort of what SPS is a lot. A lot of us that deny that stress triggers our rigidity say that. I don't have that. I don't have that. I say that, and I do have it. It made me feel weak, less mentally strong. And that's what I've spent my whole life trying to do, is become, mental. Um, you know, and it made me feel weak. And now I don't. If I'm struggling with any mental health symptom, I don't ever think now. And I'm 8 years deep, post diagnosis, let's say 8.5. So I'm ready to say, I don't even think, am I crazy? I think, my mood has been really bad these last like 3 months. And while I can't reach for an SSRI personally, like I said, everybody's different. This is not medical advice. While I can't ask my psychiatrist or neurologist for an antidepressant, which is common in a pain condition to have an antidepressant on board, but in my muscles, serotonin and my muscles don't get along. So that would be a poor choice. So maybe I've got to use CBT then for depression. So knowing about these things is super important. The good news is many of us have access to now telehealth and things like that. And also we've got the internet, and there is good information in terms of the stuff we're dealing with. It's the symptoms we deal with. They're not the crazy, crazy, crazy kind that only the trained professional can deal with. They're the type that you can mostly take to your neurologist, and then they can guide you whether you need somebody else on your team in mental health to give you the tools or give you the meds or whatever stage you're at.
Oh,
Nobody's crazy here.
thank you. Uh, so I think as an overview, thank you for all your answers. But you said two interesting things just to wrap up. You opened a thing that I think we should tackle in heart to heart eventually, the psychosomatic and whatever they call it, functional neurological disorder and everything, because
Mhm.
um, I, for one, had both. And then when I got a diagnosis, the functional disappeared. And I think it's very interesting, but it's a long topic and it's a topic that deserves a long conversation. But you also said that we have to acknowledge that our mental health is affected by this disease and we have to take care of it and we have to identify what's wrong and we have to help ourselves because it's easier to a certain extent to go to the neurologist, be diagnosed and like, treat your spasm, your stiffness and everything. But to be okay with recognizing that, your mind needs a little bit of help. I'm talking personally. I'm not talking about other people. Like you said, you want to be strong, but to be strong, you need to work on all aspects of this disease. And I think you told us everything, and I really thank you. And as always, I
I
love doing these heart to hearts with you.
I do too. Thank you for asking me those questions. I know that sometimes I don't think about things that are basic. And so if anybody out there has any super basic questions about mental health, that again, we're all variable. This is not medical advice, but we are more than happy to, address things like that. So thank you, Leah, again for doing another episode of Heart to Heart with me because like you said before in a previous episode, it gives me therapy and it's good for me. So thank you guys out there. Thank you, Leah, and hope you all are well.
Bye.